Maverick's riveting speech on balancing government intervention and market efficiency during crises. The challenges and the need for a collaborative approach. Governments often face challenges when it comes to the efficiency of their policy operations, particularly during times of crisis such as the COVID-19 pandemic. There are several factors that can explain this inefficiency, and in some cases, it may be more optimal to allow private sectors and free markets to handle certain aspects. Here is an expanded list of factors, with more details and examples to support the points. 1. Bureaucracy. Government institutions often have complex hierarchies, rules, and regulations that can slow down decision-making processes and impede effective action. For instance, during the COVID-19 pandemic, approval processes for medical supplies and emergency measures were often delayed, leading to slower responses to the crisis. 2. Resource constraints. Governments often face limited resources, which can affect their ability to respond to crises effectively. In the case of the COVID-19 pandemic in cities like Shanghai, there was a high demand for medical personnel, equipment, and other resources. This led to difficulties in forming effective ambulance teams and other emergency services, resulting in traffic jams and delays in providing care for patients whose lives were in danger. 3. Lack of adaptability. Government policies are often formulated based on previous experiences and established protocols, which might not be suitable for rapidly evolving situations like a pandemic. For example, some countries' initial responses to the pandemic were based on their experiences with previous outbreaks, such as SARS or MERS, which may not have been adequate for the unique challenges posed by COVID-19. 4. Information asymmetry. Governments might not always have access to accurate and up-to-date information, particularly during emergencies. In the early stages of the COVID-19 pandemic, a lack of reliable data on infection rates and transmission patterns hampered governments' ability to make informed decisions and allocate resources effectively. Five. Centralized decision-making. In some cases, centralized decision-making can result in delays and inefficiencies, as decision-makers may not have a comprehensive understanding of the situation on the ground. And local-level actors might be better equipped to respond to specific challenges. For instance, during the pandemic, local governments may have been more aware of the specific needs of their communities but were unable to act due to centralized decision-making. Six. Inefficient resource allocation. Government-controlled resource allocation can sometimes be less efficient than market-based systems. For example, during non-quarantine times, any car can transport endangered sick people to a hospital, which may be more efficient than relying solely on government-provided ambulances. 7. Political considerations. Political agendas and priorities can sometimes influence government decision-making, leading to suboptimal policies. This can be seen in cases where governments prioritize economic concerns over public health, or where they downplay the severity of a crisis for political reasons. 8. Inadequate infrastructure. In some cases, governments may lack the infrastructure needed to respond effectively to crises, leading to inefficiencies in service delivery. For example, during the COVID-19 pandemic, some countries experienced shortages of hospital beds, medical equipment, and testing facilities, which hindered their ability to provide care for both COVID-19 and non-COVID-19 patients. 9. Insufficient coordination between government agencies. A lack of coordination between different government agencies can lead to inefficiencies and delays in implementing policies. For example, during the pandemic, coordination challenges between health, transportation, and emergency management agencies may have contributed to traffic jams, slow ambulance response times, and other issues. 10. Overwhelmed healthcare systems. During emergencies like the COVID-19 pandemic, healthcare systems can become overwhelmed, leading to long waiting times in emergency rooms and inadequate care for non-COVID-19 patients. This can result in more deaths, as people with non-COVID-19 related health issues may not receive the care they need. In summary, while governments have an important role to play in managing large-scale crises like the COVID-19 pandemic, their policy operations can sometimes be inefficient due to factors such as bureaucracy, resource constraints, lack of adaptability, information asymmetry, centralized decision-making, inefficient resource allocation, political considerations, inadequate infrastructure, insufficient coordination, and overwhelmed healthcare systems. In certain situations, it might be more optimal to allow private sectors and free markets to handle specific aspects of crisis management, as they can be more adaptable and responsive to changes in demand and supply. For instance, allowing private transport services to assist in transporting endangered sick people to hospitals during non-quarantine times can help improve response times and alleviate some of the burden on government-provided ambulances. However, it is important to recognize that governments play a crucial role in managing large-scale crises and coordinating efforts across various sectors. A balanced approach, where governments focus on large and important projects while allowing markets to allocate resources in other areas, can help strike a balance between the need for efficiency and the need to protect public health and safety. This approach can also help ensure that non-COVID-19 patients receive the care they need during times of crisis.